Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we bring you key experts in the fields of nutrition, prevention, integrative, and lifestyle medicine. Today's show topic is Know Your Real Risk of Heart Attack. My guest today is Dr. Warwick Bishop. He's a cardiologist from Hobart, Tasmania in Australia. I just got finished interviewing him. And he is a cardiologist who wrote the book, Know Your Real Risk of Heart Attack. And he has a very interesting story. He's has a preventive outlook by nature. And one day he was going to work actually on a Saturday, and he noticed that there was a commotion on the side of the road. Turns out someone had a cardiac event and was being resuscitated. He went and helped out. The person lived. And in the next week or so in his office, he was showing his staff the picture in the paper because the guy had done very, very well. And it turns out that this was a patient of his several months, I can't remember exactly how long, but I think it was more than a year ago before, and he had been cleared after stress EKG of any heart issues. And that stunned him. And that sent him on a kind of a journey, an introspective journey of finding out, why, if we did the basic things that we were supposed to do, could this person have a sudden cardiac event. Serendipitously, with going to conferences and things, he came across the technology of coronary calcium scanning, and also the extension of that when you put the dye in the vein of CT angiography. And he's become a great advocate of that. And CT angiography, or excuse me, coronary calcium scanning, stands for the calcified plaque in the artery, which represents an estimate of what the plaque in the inner arteries, or the softer plaque, may be, and it gives a coronary risk. So he's a very strong believer in doing the screening test, but as a gatekeeper. In other words, if he finds any plaque, a calcified plaque, he will generally suggest to that person that they go on and have a CT angiography, which is actually the dye going in there so you can see the different types of plaque, and then also how much of that plaque is there, and also where the plaque is, and then also the narrowing of the arteries. So a little more aggressive, I would say, or in a good way, and here's his argument. If you take 100 men age 50, 50 of those individuals will die of some type of heart disease. 25% of those people, or 25 of those 100, will have a totally clean coronary calcium score. So their risk of heart attack in 5 to 10 years is very low. So that means out of the 75 that are left, 50 of those people will die from a cardiac event. So why not do the more sophisticated testing that tells you the type of plaque? So calcified plaque is stable. That's what the screening coronary calcium score tells you, and that's without dye. When you do the same test in the machine with dye, you get to see the types of plaque inside the coronary artery. And there's three main types of plaque. There's a fibrous cap, which is maybe protective, and might be the next step would be calcified plaque. Then there's a mixture of fibrous and fatty plaque, and then there's what's called the necrotic core, or low attenuation plaque, with a much inflamed plaque, which may rupture. So you can see those different types of plaque on the CT angiography, the technology when you get the dye. And also you can see the location of it, which may represent a different type of intervention therapy. You can also see the general narrowing of the arteries, or stenosis. So all those things come into play, and you can see those better on a CT angiogram. That's with the dye versus just a coronary calcium scan. But either way, he's a big fan of the technology. So he would describe the coronary calcium score, the initial scan without the dye, as the gatekeeper. If those people don't have risk factors and there's no calcium, no further testing or therapy is needed. In fact, he gave himself an example. He has a clean zero coronary calcium, so he didn't put himself on, let's say, a statin drug. One of the other things that stands out strong in this early intervention effort is that it's the same essential technology or the same thought process as getting a mammogram. what I'm trying to say is that in men and women, the number one killer in the world is heart disease. And in women, the number one killer is still heart disease, and it is much more extensive than the breast cancer, which gets much more play. And yet, routine mammography is done as a standard, even though it's debated, but it has been done as a standard. So why not screen women for coronary calcium status, since it's the number one killer? And makes perfect sense. So his general presentation or recommendation is in men, unless they've had some other prior cardiovascular or significant risk beforehand, they would get a screening coronary calcium score. If there was any calcium, he would encourage them to reflex it to the CT angiography. At age 50, men would have that, and age 60, females would have that. And then, with that information, he can devise an individualized program that deals with medication, nutraceuticals, and diet. So it's obvious when you listen to the podcast his passion to educate the patient, to get early information so you can make an individualized program for that individual. So this is the name of the book, Know Your Real Risk of Heart Attack, by Dr. Warwick Bishop. And I'll have that information and link to his website underneath this podcast and summary on YouTube. My name is Kirk Hamilton. Go to stayinghealthytoday.com. I'll talk to you soon, and you have a fabulous day.